Good morning. So I'm Paul Convery. I'm a clinical professor of healthcare leadership and management out here. I've spent my entire career in healthcare and have touched virtually every aspect of it, from practicing physician to running large medical groups, to being a hospital president, to be a senior executive in a couple large health systems, and even ran a small insurance company at one point. So it's not surprising for me that Medicare for All, or a discussion of the National Health Insurance Program, is on the agenda this election cycle. But what is surprising is that it's a major topic, and for the first time in 50 years, it has broad support and majority support across the American public. Medicare for All was first promoted as a public policy topic in 1970, and it was advanced by Senator Jacob Javits, a Republican senator from New York. And the concept of a national health insurance program has been on the election cycle since the days of Harry Truman, and has come up more or less pretty much every cycle, but hasn't gotten a lot of national attention or national traction. Mainly because the public were very comfortable with the status quo. They felt that their employee-based commercial insurance was a pretty good system and was taking care of them okay, and they didn't see a big need to change. What has happened, and just as a side, all the graphics are from various surveys. The source of the survey is mentioned on the graphic, and the dates are all relatively recent, some as recent as a month ago. What has changed is that cost of health care, as Dr. Fleming pointed out, has become an unsustainable burden to the American public. This has been most acute over the past decade, and the average voter has reached their breaking point. For Americans with commercial insurance, this is employee-based commercial insurance, and that's about 160 million people. If you throw in the people with individual plans, it's 180 million people, so that's the majority of Americans. Over a third of those with serious medical conditions have said they've used up all their savings to pay for health care. 70% of Americans say that they are cutting back on food, clothing, or other basics to pay their health care bills. And 30% of Americans with insurance, with good commercial employer-based insurance, say they cannot afford health care if they got sick. The World Health Organization has said recently that the American millennials will spend between 50% and 70% of their lifetime earnings on health care. That's an unsustainable number. So what has happened is you now have 60% of Americans supporting the concept of a single-payer system. And this has grown dramatically over the last 40 years. And if you go back to the 1950s, it's just really a dramatic increase. But it follows that massive increase in cost of health care that Dr. Fleming shows you on the previous slides. The out-of-pocket cost of health care, surprise, unexpected medical bills, escalating drug costs, higher deductibles and co-payments have hit them in the pocketbook, and Americans vote their pocketbook. The promise of the current health care system, as it's been set up for the last 50 years, solving their problems, that promise has been broken for many of the average Americans. Now let's look at the Medicare for All proposals. There's about 10 or 11 different bills filed in this Congress under the rubric of Medicare for All. I've broken them into categories to make them a little bit easier to understand, and if you have this slide, you can maybe follow the debate over the next year and a half a little bit easier. All the bills have been submitted. Some have had limited hearings, but most of them haven't even gotten to the committee section, and they're not going to be passed this congressional cycle, that's for sure. The first one is a single national health insurance program for all United States residents. That's sponsored by Senator Sanders and Representative Hayapal, and it has multiple co-sponsors. It's a national health plan, replaces all government health care insurance, including Medicare and Medicaid, and replaces all private insurance. There's no premiums or cost sharing. It's paid for by various taxes, progressive income tax, employer tax, inheritance tax, capital gains tax, wealth tax, etc. Coverage extends to dental, vision, nursing home, long-term care, pharmacy, etc. And there's a national budget and a fee schedule for hospitals, physicians, and pharmacies. The second grouping there is a new public plan option based on Medicare, and it will be offered within the Affordable Care Act marketplace, sponsored by Senator Bennett, Kane, and Delgado, called Medicare X. It's a public option plan on the exchanges. There are premiums that will be paid and co-pays. There will be subsidies for less than 400% of the federal poverty level. HHS sets a premium and negotiates rates and pharmacy costs and rates for hospitals and physicians. Second bill in this category, sponsored is Senator Cardin. It's Keeping Health Insurance Affordable Act. Is a public option plan with cost sharing and co-pays. HHS again sets a premium. Subsidies are available as before, and it negotiates rates for hospitals, physicians, and pharmacies. The third big grouping there is a Medicare buy-in option for older individuals not yet on Medicare. It's sponsored by Senator Stabenow and Representative Higgins. It's a Medicare buy-in plan for people between age 50 and 64. Again, there's individual premiums with subsidies. Medicare Advantage option, which Dr. Fleming mentioned, that's the Medicare Part C, the private insurance company option. HHS negotiates and sets rates, including pharmacy, managed by Medicare with a separate trust fund. The fourth is a Medicare for America Act of 2019, sponsored by Representative DeLauro. All United States residents would be covered under a public option, so everybody's covered by a public option unless they opt out for a qualified health plan offered by the employer. So it would eliminate all individual insurance plans, but would keep the employee-based group insurance. There's an option for Medicare Advantage, would eliminate private insurance on the individual market, federal subsidies for premium as before, premium limits 8% of income, and HHS sets reimbursement rates. And the last is a Medicaid buy-in option that states can offer through the ACA marketplace, sponsored by Senator Schatz and Representative Lujan in the House. States can offer a Medicaid buy-in on the marketplace with individual premiums or subsidies as before, managed by the states or Medicaid managed care organizations. Now, except for the first of these, the single national health insurance program, the rest are all a version of Medicare option. They would all preserve the private insurance market in some fashion. Some would maybe even work through it with Medicare Advantage. They would work with the Affordable Care Act and the exchanges. They would all set a negotiated fee schedule for hospitals, pharmacies, and providers, although not necessarily at the current Medicare rates. Now, this negotiated fee schedule approach is what every other developed country uses, and that would go a long way to hold down overall healthcare costs. Most experts agree that the main driver of the escalating healthcare costs are healthcare prices and charges, not utilization. Actually, the data shows American healthcare utilization is below that of every other developed country. Now, there's a lot of room in Medicare rates. The American Hospital Association tells us that Medicare only covers 87% of hospital charges. A recent RAND analysis on transparency of hospital insurance charges show that Medicare charges, that commercial prices paid by insurance companies to hospitals and health systems ranges from 240% of Medicare to 1,000% of Medicare. So if the reciprocal, if you take the American Hospital Association number of 87%, 115% would cover hospital charges. So there's a lot of range between 115% of Medicare and 1,000% of Medicare to find a price that might be negotiated. But that's not available now, so we don't negotiate pharmacy, or we do negotiate them in the insurance market, but as the RAND study has shown, has not been terribly effective to date. And these all provide some type of subsidies or tax credits for those at or near the federal poverty level, and they all would be separate from the Medicare Trust Fund, so they would not theoretically impact the Medicare Trust Fund. Now, multiple polls over the last couple of years show that healthcare is clearly the #1 issue on voters' minds. And this has been repeated in multiple surveys. Some of the numbers vary some, but healthcare and healthcare costs are the major issue.